Hello friends, so our today's topic is early childhood caries. This is the very important topic in pediatric dentistry. Early childhood caries, according to American Association of Pediatric Dentistry, the early childhood caries is presence of one or more decayed, cavitated and non-cavitated lesion missing due to caries or filled tooth surface in any primary tooth under the age of 6. So what is severe ECC? Severe early childhood caries is any smooth surface caries in child younger than 3 years of age, one or more cavitated and non-cavitated, missing because of caries and filled tooth smooth surface in primary maxillary anterior teeth, and with DMF score more than 4 in 3 years old children, more than 5 in age 4 and more than 6 in age 5. Early childhood caries is very common in children and infants, and it mainly involves the primary teeth. So coming to the various terminology used by different author for early childhood caries, in which early childhood caries is the common term. For ECC, according to Winter termed ECC as nursing caries, Moss termed ECC as tooth clearing neglect, Horowitz termed ECC as infant and early childhood dental decay, and ECC terminology was given by Davies. Nowadays, a recent term for ECC is MDS-MD, maternally derived streptococcus mutant disease, since the bacteria mutant streptococci derived from mother to infant. Coming to the classification of ECC given by Wien, Wien classified the ECC into three types. Wien classified ECC into three types, type 1, 2, 3. Type 1 is mild to moderate caries, which occurs in 2 to 5 years of children, where the isolated molar and incisor is involved. Type 2 is moderate to severe, where the labiolingual surface of the maxillary anterior is involved. Then type 3 is severe, where the tooth is severely destructed and lower incisor, which is generally resistant to caries, is involved. Coming to the developmental stages of ECC, the stages of ECC is classified into 4 stages, stage 1, 2, 3, 4. And stage 1 is initial reversible stage. The tooth is involved cervically and there is chalky white discoloration of the tooth and there is no pain. Stage 2 is damaged caries stage, where there is slightly brownish or yellowish discoloration of the tooth and the dentine is involved, so there is pain on taking the cold item. Then stage 3 is deep lesion, where there is severe pain because the pulp is involved and the caries is deeply involved. Stage 4 is traumatic stage, in which the tooth is fractured or completely involved and that sometimes the tooth is non-vital. Coming to the various risk factor can be divided into primary risk factor and secondary risk factor. Primary risk factor is the main factor responsible for ECC, like plaque accumulation and inadequate oral hygiene, then the mutant streptococci, and then the infant feeding pattern, long prolonged feeding pattern during the night, bottle feeding is also involved. Then the toothbrushing, if it is not proper, then ECC can occur. Then the saliva factor, if there is hyposalivation in the oral cavity, then there is lack of neutralization of acidic food and which leads to the caries development. And then intake of sugary items. Then coming to the secondary risk factor, immunological factor, the tooth maturation and the tooth defect. In those teeth which are not mature, they will have the early caries or the caries involvement, then race and ethnicity, and then the acidic drink item, then the socioeconomic status, and then stress is directly proportional to the caries. Coming to the prevention part, for early childhood caries prevention, first the diet counseling should be done. Diet should be proper, there should not be prolonged feeding pattern, and then the fluoride application on the just erupted tooth or the newly erupted tooth, and then the endodontic treatment should be done in which there is pulpal involvement, and then the prosthetic rehabilitation of those teeth which are completely destructive.